Hello and welcome to Happy Valley Medical Center. I am Dr. Goodhands. Happy Valley is facing a significant staffing crisis. Our ability to provide quick and professional responses to our patients who call in and provide feedback to patients after their visits is jeopardized by the current staff shortage. Unfortunately, we anticipate the shortage to continue for the foreseeable future. We have asked the WB1 consulting team to develop an advanced technology solution to address our issues using the latest technology. Specifically, we need an automated process to respond to patient calls and address their needs, including scheduling of appointments and responding to all other needs when they call into the office. Additionally, we need the system to reach out to patients to follow up after care. Most importantly, it is critical that the patients feel like they are participating in their care. Transparency and trust are core values of the Happy Valley Medical Center. At Happy Valley, we pride ourselves in our transparency with our patients. The patient must feel that they are part of every healthcare decision. Nothing is ever written in a patient record without being reviewed with the patient. Patients must be provided with explanations of all prescriptions, rehab exercises, or other action that is recommended by the AI. We require full compliance with HIPAA, both in the letter of the law and the spirit of the law. All information exposed to AI must be protected. Personal identifying information must never be exposed to AI model training or exposed to the risk of a data breach. We anticipate that errors will occur in AI. The potential for errors must be minimized. All errors that do occur must be quickly identified and corrected. The correction must be explained to the patient wherever appropriate.
Our proposed solution at WB1 consulting team is to fully integrate our proprietary AI medical office system suite, which has a foundational model of Mistral, but also has training data based on the International Classification of Diseases, the Merck Manual, Harrison's Principles of Internal Medicine, etc. This system will allow Happy Valley Medical Center to automate responses to patients while simulating a medical secretary. There are numerous benefits to this AI system, including the system providing improved assistance with diagnosis and streamlined communication. This should improve patient satisfaction and outcomes. In the rare event of a hallucination or malfunction, our AI system does have explainable AI, so the problem can be reviewed and corrected. The two-part solution will address calls into the office as well as follow-up calls to the patients. Here is an example of our Copilot decision tree simulation process flowchart. The patient starts by trying to schedule an appointment. Firstly, following procedures, the AI secretary clarifies that this is a simulation of our clinic system. After confirmation, the AI will begin collecting responses. While collecting symptoms and relevant information, depending on the response, the decision tree may send the conversation into 3 to 4 different routes. Those 3 main routes include emergency symptoms, urgent symptoms, and routine symptoms. Each route is critical to patient safety and has been thoroughly tested with all branches of the business, including providers, HR, and legal. Triggering an emergency symptom, patients are routed to a 911 operator and recommended to go to the nearest hospital. Emergency symptoms include issues like chest pain, which could be an early symptom of a heart attack. These types of symptoms are urgent, and we will not continue any other conversation, same as any other primary care office. When urgent symptoms are triggered, we will prioritize appointments. The prompts will then go through the earliest appointment time and be an interactive conversation with patients to ensure our schedules align. When routine symptoms are identified, we conduct a more thorough analysis. We then match the patient with a provider who has the earliest available opening. We collect information on the most preferred time slot and prepare patients for the visit. In the scenario where there is a phishing call for sales, the AI will ask questions on if this is a patient care-related call. If not a patient care-related call, the call will be ended so phone lines are not backed up.
The following slides demonstrate a sampling of the responses that will be generated from the AI solution. As we have said throughout the presentation, the addition of technology into the patient's care will enhance their care by providing critical information to the patients quicker than would have been possible in a traditional staff-based solution. A medical office assistant can spend the majority of their day scheduling appointments. This is a value-added step inside a medical clinic. However, it can be optimized with the new technology being presented today. Our medical office assistant AI demonstrates how it can successfully schedule patients' appointments. Note how the medical office assistant AI collects symptoms to check for a possible emergency situation. Next, it verifies the patient's date of birth. Please note the courteous tone and how it is recording steps to be added into the patient's file. Finally, the medical office assistant AI proposes and confirms the appointment with the patient. If the appointment time is not acceptable to the patient, the medical office assistant AI can find a more accommodating time with another doctor. The medical office assistant AI will be able to have more one-on-one time with patients during the scheduling portion if needed. Also, the medical libraries and the training data will be available for the AI to help consult the patients with. The AI will be able to escalate issues to office medical staff if necessary. Another added benefit is this medical office assistant AI could be available 24 hours a day, 7 days a week, and not take holidays to help serve patients' needs. In some cases, patients need to communicate back to their doctors or medical staff for clarifications of their previous visits. This is not a value-added step, but is a very important part of patient care. This step helps form a bond between a patient and medical staff. A patient can feel at ease knowing that they can communicate freely with the medical office even after the appointment has taken place. In this scenario, the medical office assistant AI demonstrates how a patient could call in and access the instructions from their last office visit. Again, note how the medical office assistant AI requests verification of the patient's identity prior to releasing information. After providing a detailed bullet point summary of the visit, the medical office assistant AI offers to schedule another appointment and closes cordially. All the while, the medical office assistant AI is timestamping and adding this information to the patient's file. This type of service will help Happy Valley Medical Center excel in customer satisfaction and stand out from other medical centers with their new level of customer support. This medical office assistant AI, in this training scenario, is provided with a prompt to contact a patient for follow-up. This prompt could be generated by something like Microsoft Power BI or another office assistant prompting the medical office assistant AI. Please note the medical office assistant AI is polite and asks the patient if this is a good time to talk. Next, the medical office assistant AI checks in with the patient to discover how the treatment is progressing. The medical office assistant AI confirms that the treatment is going well and there is nothing more that needs to be done. The medical office assistant AI is polite throughout the entire conversation. This technology has the potential to transform the medical treatments for some facilities. Many treatments fail because patients forget to continue their treatments, or symptoms may worsen before the patient reaches out to their doctor in time. This medical office assistant AI can help fill that void and follow up to make sure patients are still following their treatments, but also to verify the treatments are working as expected.
Just like any type of technological solution, AI also carries risks. First, HIPAA and privacy are critical risks within the healthcare industry. Patient health records must be protected by using HIPAA-compliant systems, BAAS, encryption, and audit logs. The system failing to recognize emergencies, such as chest pain being overlooked, is another risk. To prevent this, the AI will prompt patients to call 911 and escalate unclear cases to a live nurse or doctor. Scheduling and follow-up errors. If AI misinterprets patient requests is another major risk. This could contribute to a delay in care or cause patients to miss critical appointments. To address this, a human in the loop will oversee complex cases. There will also be automated reminders and escalation alerts to ensure follow-ups are not missed. This hybrid approach of automation and human oversight keeps patients on track. The healthcare systems have been common victims of system hacking. To reduce risk, we will use firewalls with built-in VPNs, endpoint protection, and role-based access controls. Bias in AI recommendations is another potential risk. If AI systems aren't trained on diverse patient data, diagnoses could be less accurate. We propose bias audits, and diverse testing will be built into the system to help mitigate this risk. Patients will use phone, chat, and portal as communication channels. If each channel gives a different answer, trust will be compromised. A single back-end pipeline ensures consistent responses across all channels. We also must avoid over-reliance on automation. All patient-facing outputs will undergo human-in-the-loop review. This ensures AI supports care but doesn't replace the judgment of the physicians.
The UB Group 2 consulting team is providing the technology to Happy Valley at a below-market rate. In return, Happy Valley has agreed that UB Group 3 will retain the rights to all software developments resulting from the relationship between UB Group 3 and Happy Valley. UB Group 3 will market the solution to other providers in the region. Happy Valley agrees to present the solution at the next 2 State Provider Association meetings with the UB Group 3 team. We believe the solution developed for Happy Valley will be able to be implemented at provider groups throughout the region, improving the quality of care for thousands of patients. The return on investment for Happy Valley should be calculated by determining the present value of the future staff savings, including wages, benefits, training, and so on, to be reduced by the technology divided by the cost of implementing the solution, including Group 3 fees, staff training time, equipment necessary, and the present value of ongoing technology support costs. The ROI for the Group 3 consulting team will be more difficult to calculate. The total cost to develop the solution plus the development of training and a significant portion of the time associated with refining the product during and after implementation will not be covered by the revenue received from Happy Valley. The development cost will be spread across the next 5 provider implementations. The revenue received from Happy Valley divided by 1/5 of the development cost plus the Happy Valley specific training and software customization cost to determine the profitability of the Happy Valley implementation. 3 metrics should be added to the clinic's key performance indicators. Patient retention rate is the ultimate determinant of patient satisfaction. The calculation determines the number of patients seen in a given year that were patients of record as of the first of the year as a percentage of the total number of patients seen in the preceding year. Patient satisfaction surveys should be sent out to a sampling of patients before the system is implemented and quarterly after the system is implemented. The survey should evaluate overall patient satisfaction with the practice, the quality of care, timeliness of appointment scheduling, and satisfaction with follow-up responses. Practice profitability per full-time practice partner is the ideal calculation of profitability for the practice. The practice profit is calculated as all patient-generated revenue less, all practice costs excluding any payouts, salaries, or expenses incurred for the partners.
UB Group 3 has provided an innovative prototype to help address multiple concerns with the medical clinic as it relates to office management systems. The medical office assistant prototype can schedule appointments, provide follow-up care, and review the patient's notes from previous visits with the patient. The AI further builds trust by allowing the patient to review the AI-generated notes with XAI in the forefront of the design process. In addition to these tasks, the AI can review the patient's symptoms for serious life-threatening issues that need escalation to emergency services. Overall, as patients interact with the AI and realize the AI's potential, we believe trust will strengthen with the patients. This medical office assistant will help provide technical assistance in rural areas and other locations that are scarce of medical professionals. The implementation of this medical office assistant could help contribute to higher quality and lower cost healthcare.
Thank you for sharing your time with us today. We also would like to thank the staff at Happy Valley Medical Center who were instrumental in shaping the solution. We are looking forward to a long and successful relationship with the center as we implement the solution in other provider groups throughout the region.